Hey, Doug Sanquist here. I decided to start my podcast over again. Um, I did it during COVID for a while, and it's called the Doug Sanquist Podcast, where um, being interested is interesting. Kind of a weird play on words there. Um, and I had a little script, and I was going on this kind of crazy path, and um, it kind of got boring after a while. I mean, just didn't get excited about doing it. Um, but last Christmas, I found Dr. Jack Kruse. He'd just done a podcast last year, about a year and a half ago, with Rick Rubin and Andrew Huberman. He also did a podcast with Max Goldhain on the Regenerative Health podcast, and he basically opened my eyes to a whole new world of quantum biology. And he's also one of the smartest people I think I've ever heard about or heard from. Interesting thing about Jack is that Dr. Kruse, is that he's a dentist that then went to his oral surgery residency and then transitioned to become a neurosurgeon. So he's a DDS, MD, and a quantum biologist. He also, in 2005, he had a well, if you listen to those podcasts, you'll hear the whole entire story. I mean, those podcasts are about 10 hours worth of content, 10 to 12 hours of content if you want to get through them. Max's first podcast with him on regenerative health was 3.5 hours. I've listened to that a few times. That's well worth your time. It's a good primer of who Jack is and what his story is. But over the last 6 months, I've been studying the work of Dr. Kruse, and I've always had this gnawing notion that I need to talk to him, because there's a few things that, as a dentist, I'm curious about. And while I don't specifically treat sleep apnea, dentists can't diagnose sleep apnea in general. That's usually done by the sleep physicians. There's lots of things in dentistry that actually affect the airway. And so the upper jaw, the position of the tongue, all of those things are in our wheelhouse that we actually diagnose and we see. So there are treatments that are available to us that can actually improve or make those things better or bigger. And so the theory goes, if you're able to make the size of the jaws bigger, can we improve, the size of the airway? And so I think that's a logical place to conclude. So we've had some, being a airway aware dentist is kind of a thing now. It's because most dentists don't want to cause harm. Most dentists want to improve things and make things a little bit better. So I've had a few patients over the last few years that needed expansion and needed these things done for dental reasons. And the hope is that because you make things better, the anatomy better, that hopefully that the airway will get better and the sleep will get better and it'll improve the quality of the life. That's the hope, and that's the thought process. I mean, there is data to support some of that. So I've had some clinical experience that while we can actually make things bigger, and we can improve the airway, we don't always improve the outcome of the sleep apnea. Doesn't mean that we don't do it. Doesn't mean that we shouldn't expand things. It doesn't mean that we shouldn't go down that road. But I think I found Dr. Kruse had some very interesting ideas regarding sleep apnea. Some very interesting ideas around what the cause of sleep apnea is, and I really feel like it's an important discussion to have, because it actually gets to the quantum biologic level of what sleep apnea is. And I think there is some data behind it. We definitely need a lot more research behind some of his ideas, for sure. We need people to do this research. But from my own standpoint, in some of the cases that I've seen, um, there's another layer beyond just the anatomy. And so this podcast with Dr. Jack will basically start in motion, because when you get on with Jack, I mean, it's pretty much go after one question, and I was a little tardy in getting the record button to go. So you're going to start the podcast coming up pretty soon with him answering a question regarding some of the troubles that I have seen with not getting the benefits of what we thought getting a bigger airway was going to cause. So here comes me and Dr. Jack as we embark on this journey of quantum biology related dentistry. We kind of work our way through some sleep apnea discussions. We talk about fluoride a little bit. We talk about centralized and decentralized dentistry and medicine. We even get to his experience of how he went from being a dentist to a neurosurgeon, and a few more things along the way too. So, here comes Jack answering my question about sleep apnea.
Answer, and the problem is everybody's scratching their head wondering why. And it's fucking obvious why. Because if you don't understand the basics of how cells operate, how tissues operate, what the difference when we talk about electromagnetic waves, what we're talking about, there's an electric field and a magnetic field. It turns out the story with sleep apnea is when you're so deficient in the electric waves, eventually the magnetic flux in cells controlled by free radicals goes awry. And when that goes awry, which it does in people who have apnea, because you're trying to protect yourself, apnea is actually a protective mechanism. You've probably heard me say multiple times, on Twitter or on my podcast or in other videos, that a cataract is the brain protecting itself from blue light. People forget we have more melanopsin in our central nervous system than anywhere else. So that when someone is blue light toxic, that's how you get cataracts most commonly. You can get it from other, modes. And, a lot of people have, when I say this, say to me, well, Jack, people have been getting cataracts for hundreds of years. I'm like, yeah, because guess what? The electromagnetic spectrum still comes from the sun. And just because it was 5, 6, 700 years ago doesn't mean we were doing things correctly then. That's the problem. And are there changes in Earth's electromagnetic environment that make cataracts more likely? For example, if you live in a really cloudy environment, more often than not, you're going to have cataracts more frequently than you will in a sunny environment. And people are freaked out when they hear that. I mean, I tell them all the time, the reason is because you have more steady light stability in the UV and infrared range than when you have clouds. And what's one of the side effects of having clouds that not too many people know about? That allows more cosmic and gamma radiation extraterrestrial to come through the Earth's atmosphere. That's actually what causes the cataracts. Then you have the welders. The welders get more cataracts. Why? Because they're around light that generates it. A ton of near infrared light, meaning heat, actually will also stimulate cataracts. And we know that from even Becker's book, because he's put out there, I'm trying to remember the name of the guy. Oh, Savitz. That's what his name was. An ophthalmologist from Scarsdale who worked for the military when Becker did. And his work was also shelved by the military because he found that non-ionizing radiation actually led, to cataract formation in biologic changes. And of course, this was the inconvenient message that the federal government really didn't want to know about. I would tell you, though, the same thing is happening with apnea. Right now, you have sleep experts, dentists. I mean, you got all kinds of fucking wackadoodles in this space doing shit without them knowing stuff. It's kind of like you having a Ferrari and letting some guy, down at the street, just because he's got brand new tools, work on your car without having any knowledge of what the fuck they're doing. And if you want to do that, great. But I think before I would let anybody do anything on me, that includes a machine, a device in the mouth, any type of surgery around the oral cavity for sleep apnea, you have a duty as the patient to understand that anything they do is just like a surgery, and it can lead to irreversible changes. So what am I saying to you very clear as a dentist? Just the act of putting a retainer on the teeth or palate expansion or a plastic retainer is no different than when a surgeon goes in and does surgery, say for orthodontics, or say a uvula
U
plastic.
triple P or whatever it is. Yeah.
Right. And that's not how people look at it. And when I say this and people think this is hyperbolic, then I immediately turn around and say, okay, how come, tell me, when Medicare pays for people with central sleep apnea who have apnea machines, they get cancer more frequently? Explain. No one can. Everybody knows that the link is there. It's in the literature,
Right.
but no one can explain. And it turns out sleep apnea is the body trying to protect itself from unabated ROS. Why? Unabated ROS leads to cancer. And what abates the ROS or the RNS signal? Melanin. So look at every person with sleep apnea. You know what you're going to find? Everybody knows the link to obesity. Well, what if I already told you what the link to obesity was? No fucking melanin in the leptin melanocortin pathway. So it would stand to reason that sleep apnea is exactly the same thing. It's just that the melanin loss is in a different part of the hypothalamus and the neural tracts. Most of that melanin loss, as I wrote in the Patreon series, is right at the DLF, which is the dorsal longitudinal fasciculus. That's almost always where they have it. And the thing is, when you try to blow open with positive pressure, which is what CPAP is, you allow more oxygen in. What does more oxygen mean to a bad mitochondria? You make more ROS. And then you have no way to buffer it.
Right.
It's not rocket science, dude. It's common sense.
It is, and that's actually what I found, because I have a few patients who we expanded them, and there's been no change in their apnea. There's been no change, and actually, they can breathe, but we're just throwing in more oxygen into the system, which is exactly.
So you need to actually, if you're a good doctor, a good dentist, you need to tell those people you might want to go get term life insurance before you go any further. And I'm being dead serious when I say this. I'm not being hyperbolic. Obviously, that's going to cause you a problem.
Right.
But you need to tell them, because your apnea has not gotten better, you probably should not use any machines or devices or do anything. Leave your body alone and let it self-correct. And the real issue with those people, and you'll be surprised to hear this, the single most important thing for those type of patients, like what I would do if they contacted me, I'd make sure that their trigeminal system, they always had melanin. They always were constantly in the sun. I'd actually want them, even to the point, I don't advocate people getting sunburn, but I don't think sunburns are toxic like centralized medicine does. But for someone who's got this problem at the brain cell level, who's been manipulated, centralized ideas, your goal is you have to balance the switch between ROS, RNS, and ATP production. And I don't think people realize that the electric field really is tied to the ATP story. The magnetochemistry is tied to the ROS and RNS story. And it turns out, if you asked me which are the most important, I think it's the magnetochemistry that's much more important. Why? Because that's what controls metabolic flux. Like, how do certain tissues make the decision to use beta oxidation, the PPP, glycolysis, gluconeogenesis? That decision is predominantly made between the stochastic ratio between ATP, ROS, and RNS. That's actually how it's made. And that's the reason why I actually just said this to Alexis Cowan a couple of days ago when I did the podcast with her, that I don't really think that people understand that ATP too high. Like, what's the flip side of this story that I'm giving you on the ROS side? If you have too much ATP to ROS, that also is a cancer situation. So believe it or not, ATP actually comes with a detriment too. The flip side that we're talking about with apnea now is ROS and ATP's down here. That's also leads to cancer. And many people don't understand that the fovea in the retina is designed not to have any blood vessels in it. What does that tell you? It runs a normal Warburg metabolism. So it has a lack of blood. What does a lack of blood mean to a dentist or an MD? It means that it has low oxygenation by design.
Right.
What does low oxygenation mean? It means low ATP. It also means ROS is controlled. Well, what do you know is right around the fovea? The RPE, tons of fucking melanin. Guess the reason why? Because that's what buffers the system. And if you look into Wunsch's videos, Alexander Wunsch, he does a really good job in one of them. I forget which one it is, where he talks about how the distance between the photoreceptor and the fovea is from the circulatory system, and what is finishing the job there. It's near infrared light, actually, to do signal transduction in the eye. My belief is the same thing is true for people with ROS, and I think most ROS is done through neural crest destruction from the leptomelanocortin pathway from the hypothalamus to the brainstem. And that's going to affect probably cranial nerve 1, I think all the way down to about cranial nerve. In fact, it may even be to 12, but I'd say at least to 10. And I've often wondered if I could get a neurologist to really understand the stuff that I'm talking about. I believe that if we did EMGs of people's tongue, that we actually may begin to see like fasciculations and fibrillations in the EMG. That would actually give us a clue of what at least the electric field is in the brainstem through the DLF. And I think the flip side is we could use probably vitamin D, and we probably could use nitric oxide in the blood as a proxy for the magnetochemistry side. Remember, they're proxies. They're not one-to-one, okay? But it gives you an idea. The reason I said something about the EMG, which would be interesting, because remember, the EMG gives an idea of what the nerves are going to the muscles through the motor end plate. So if we saw changes there, we would know that the ATP power generated in the brainstem out to that motor muscle. Because remember, the hypoglossal muscle is one of the few cranial nerves that's pure motor sensory.
Which is why they use the Inspire stimulator for that, to actually get the tongue out of the way.
Correct. That's exactly right. And this would give you an idea of truly what's going on in this system, behind it. It's almost like pulling the curtain back and looking for the wizard, in obstructive sleep apnea or central sleep apnea, or really any of the sleep diseases that are present. Because I believe all the sleep diseases are just at different train stations from the eye and the skin through the DLF. And once, this gets institutionalized, the feedback loop that comes from all these electric membranes winds up at the VLPO neurons in which I call the hypocretin neurons. Those are the people that get the worst diseases, which are like narcolepsy.
Right.
And that's autoimmune destruction of those tissues. But it takes a lot to do that. And that means that you've had complete destruction of the neural crest cells in that part of the brainstem. And the only way to fix that is you got to get somebody, that I've told people, you really want to fix it, the best place to fix apnea is put them in a caldera inside the tropics, so that's going to put you probably Guatemala all the way down to probably Nicaragua, because Panama doesn't really have any really, big time caldera volcanoes, but Nicaragua's got quite a few. Costa Rica's got some. But I think the population density is too high in Costa Rica. I think Nicaragua, El Salvador, and Guatemala work. Panama, I'm not a big fan of, even though it's lower latitude. It's just the canal is problematic. And I think this disease is reversible. I
Mm-hmm.
think it's reversible, but I don't think it's reversible in centralized sleep medicine because they don't functionally understand what I just told you. And I certainly think that dentists who are now doing this stuff
Mm-hmm.
need to understand. I know you guys are doing it to try to help,
Right.
but you need to understand this whole, all these papers out that if you use an apnea machine, you get cancer. That should really make all of you stop and go, could the same thing be true with the stuff that we're doing in the mouth? And I'm
Mm-hmm.
going to tell you, I don't think there's any doubt that that's the truth because the mechanism is fully explainable. When you change the oxygen mix, you're actually changing the biophotons released not only from mitochondrial DNA, but there's 11 other spots, where biophotons are released. We already know that from Roland Van Wyck's book.
Right.
You know, they come from a lot of different places, and those things affect the skeletal muscle fiber type in all the muscles of the aerodigestive tract while this is going on. I mean, to be honest with you, if we had an easy way of doing EMGs of those muscles, I would think this whole paradigm would shift completely because then people would realize just what you've realized. When I've done this stuff on people, it doesn't help. And the
Right.
reason why is because all you're doing is you're working on the surface problem. You're not working on where the real pathology is.
Right. And that's been that's like my frustration and my opening. Like I realized this about a year ago. I had a few patients and like they just weren't getting better. And I'm like, it's just not anatomy. It's not just anatomy. And we as dentists are really good at just we can look at the anatomy. We can look at an upper maxilla and see that it's too small. We can look at a septum, nasal septum, and see that it's too small and say, oh, it needs to get bigger. But just making it bigger it does not solve the problem. You know.
I saw that, in my own early practice when I was an oral surgeon. When we used to do orthodontic surgery,
Mm-hmm.
I used to believe that fixing like form and function being linked, the whole idea with
Mm-hmm.
Frank Lloyd Wright, it's
Yep.
great in principle, but it's really not true. And it
Mm-hmm.
turns out nature is so wise. It's part of the reason why I think the class 2 malocclusion is so endemic, in places like England. You look at
Mm-hmm.
the royal family,
Right.
they're a walking textbook about that. And that malocclusion came to the United States because remember, we're all Brits. And yet, when you see a class 2 in the United States, it's not as common as it is in the UK. And why? Because there's been, mixing here. And I actually think the latitude changes. I think the light, I think it's all changed things. So I find it very interesting, but I do believe that a class 2 uh, and a class 3 is much more common in high latitudes. I believe it shares
Mm-hmm.
the same morphology that we see in MS and ALS. But no one's actually really done those studies. The guy that I think would be best able to do that study is Peter Unger. He used to be at the University of Arkansas, but he's an expert in mammal skulls. And he's pointed out through several of my dental friends who are really tight with him that he's never found an abnormal occlusion in a maxilla or a mandible, when you go back in the record, you know, 4,000 years. All of it's happened like in the last 5,000 years when malocclusions have come in. And it turns out where people got natural sunlight that was solid, their dentition was perfect. And that's got to raise the question to you as a dentist. Well, if that's truly the case, and you do believe form meets function, might it be not the biomechanical reasons for this? Could it be the photonic and electronic reasons that are behind this? Because ultimately, when you understand everything in a mammal runs just like what's going on in those trees behind you, everything's based on a DC electric current. It turns out that the DC electric current in some of those the structures in the head and neck They're just not there. And I think all the different sleep diseases are where that DC electronic current are different in different parts of the system. And if you don't have this perception, you're apt to default to what I call Occam's razor, because that's where I think, ENT surgeons and oral surgeons and dentists are. They just think this is all biomechanics, and it's not. Many things are biomechanical, but this is not one of them.
So I think what happens is but they go back to Western Price's research, and they show that, he went and looked around, and they tag it to food, right? And so what's happening now in the dental aware world is everyone now is realizing that their sleep, their anatomy problems haven't fixed it. So now they're all on CGMs now, and now they're trying to like link it to actually food and thinking it's like a metabolic disease. So ultimately it really becomes, it's a gateway to light, and nobody's actually looked at Peter Unger's work and actually shown, like, looked at his research from like the pyramids, and shown the CT scans of the pharaohs versus the workers, to show that
Right.
it's not food. It's probably more likely it's our light environment.
Well, the studies have actually been done by anthropologists. I think even William Grant, who's a big vitamin D researcher, has actually mentioned like the Nubians who built the pyramids, who are really dark people, from Central Africa, and the pharaohs. Like you look at the pharaohs, they have all the diseases that we have today. Like they all had osteoporosis, their bones sucked. But these Nubians, their skulls were found right next to the Sphinx. These people had perfect dentitions, and their skulls were thicker than the pharaohs who were living inside in the temples. And that's to me the best case for understanding how electromagnetism really works. It works at so many fundamental levels. Like when people, you know, point out, like they send me an old paper from NASA, or they send me this and that, where, or even some of Becker stuff, where everybody believes it's just frequency based. Like I remember getting into an argument with Magda Havis at the first Vermont talk that I did in 2016. And she made that comment to me. And I just said to myself, this is the reason why I would never let my members follow you, because this is such a myopia of how light really works. It's the same thing with the Beamer guys, all the people that use like PEMF. They have this such rudimentary understanding of what light is capable of. And I think you need to realize that there's so many other different ways that light can be changed. And it's not just a frequency story. Frequency is a big deal, don't get me wrong, but the way things are polarized is a big deal. The optical density of things is a big deal. And when you change the atomic molecular organization of tissues, you're fundamentally changing how light works with it. It's just like, a prism. If you change the prism, you don't see the seven, colors of the rainbow. But, a lot of people don't realize or have played around with light and different materials made out of a prism to see how light changes. Everybody knows Newton's experiments. Everybody knows, the Pink Floyd album cover. But when you start putting different things in there, you'll start to notice that certain frequencies are retained and other ones aren't. And that's fundamentally why we have so many different chromophores in our tissues. Why? The way in which light is working in those tissues, it's trying to cultivate some of the frequencies in light that it needs. And I think when it comes to the tissues in and around the aerodigestive system, my belief is that there's two big photo switches that are important. Nitric oxide is one of them that acts locally, but the other big one is 1270 nanometer infrared light that actually is the photo switch between ATP and ROS production. And what is the arbiter of that system? Like, what's the thermostat? Is the amount of melanin from the neural crest that's in those tissues. And then what's another, what I would guess called crossing guard in there? Those are all the B and T cells that line the aerodigestive system, that come up from the gullet. If they don't have proper functioning melanin in them or the ROS capability, that also becomes an issue. And when you see all these level or points of control, you begin to realize that you need to be awfully careful about what you're doing to the person. And that's part of the reason why I have this fundamental belief that the smart clinician, the decentralized clinician, is always going to optimize the environment before they perform an irreversible centralized procedure on a person. And, this guy that's going around right now, this Doobie and Gooby guy, the
Hmm.
neurosurgeon
Yep.
that quit, I think everybody's seen it.
Hmm.
I think that's what his come to Jesus moment was in neurosurgery.
Right.
And I had that come to Jesus moment literally 20 years ago, but I didn't decide to quit. I decided to do something about it. And, talking about something like this, I don't normally talk about this because to get to this level of sophistication, you actually have to know the difference between ATP, the difference between ROS, the difference between RNS, and you have to really understand, what those two reactive chemicals, those redox chemicals are doing. They control the flow of energy in a system by using timing. And you're never going to get to this level of sophistication through the basic science that you learn to be a dentist or a doctor. I mean,
No,
you
I,
really have to know a lot more.
I never learned it in dental school. I
Well, see, I
never,
did. I will tell you, my dental school that I went to,
I
I have
may
to,
have it, just don't remember.
yeah, I'm going to tell you, I have to give my dental school really big time ups because I thought my dental school training was better than my medical school training was. Um, and I think that's a function of the quality of the people that were at the institution at the time. But I will also tell you, they were very, very open minded, meaning, I went to one of the first four dental schools where, in fact, it was only two, it was Harvard and UConn, um, where the medical students and dental students were together and got graded on the same means. But we took actually every single course the medical students took. And we were all thrown in the same mix. And a lot of people thought that this was crazy to go to dental school in a place like that. And here's the other crazy thing: we didn't have grades; it was a pass-fail system. And it turned out that was probably good in a way, and it facilitated, I think, the openness of the training, because I literally remember biochemistry professors coming in front of our class and telling us, look, I have to teach you this shit, but I don't even believe it. That shit would never happen today
Hmm.
in a dental school, but it did back then. And I often think about my dental training, that it was very fortuitous that I went to this school, because I think that's when the fuse for me got lit. Like, that's when I learned about this guy, John Lenora. I talked about this in a blog a long time ago. You're a dentist, so you probably understand this.
I
He's a guy
I heard
from
him lecture, and then I went to Loma Linda. I heard him lecture.
yeah, I mean, he was from Loma Linda. And
Yeah.
when he talked about the dentinal parotid link, I thought, fuck, this is the most incredible thing I've ever heard. And then it made me realize that xerostomia and, xerophthalmia, they were linked through the cranial nerve system. And unfortunately, I was pretty smart when I was in dental school. So I was playing 4D chess when everybody else was playing checkers. And I had a lot of questions about this. And I remember asking my oral biology professor some of these questions. And he literally looked at me like, because Jack, I'd love to answer this question for you, because, but I really don't know. And see, I appreciate that, because he said to me he didn't know. That didn't shut me down. Like, it lit me more on fire that I would go and look for more and more and more. Unfortunately, back at that time, there wasn't there wasn't a lot of people like in dental curriculum that were doing, this kind of stuff. And Lenora is probably the first guy I can remember that there was a biophysics link to that system in the teeth. And to this very day, because this as a dentist, I get asked a lot of questions about, can we remineralize our teeth? And I'm like, we can't remineralize enamel because
Right.
the amelloblast is gone. But what we can do is we can remineralize the dentin in the teeth and repair it. So that brings up a really big issue, for dentists. Like, should you go and recommend root canals for teeth that you pulp out from, revisions or
Right.
even new cavities? The answer is no. But you know what the problem is? Incentives dictate outcomes, and dentists who at least do their own endo, or if they refer it out, then that endo is going to refer back to them. A lot of the public doesn't understand how this fucking system works. And the thing is, I just did a consult with a guy right before coming on with you, and I told him the same thing I'm about to tell you about teeth. I said, before you let a surgeon go and touch, you know, your skeletal muscles to fix the hernia or your pelvic floor, if you're a female, you need to do everything as a patient to maximize the tissues so that you're a good surgical candidate. So many people want to blame the dentist or the doctor for
Right.
doing surgery on them and fucking them up. And they don't realize that they're a bad patient.
Right.
And the reason why is because they haven't optimized their tissues
Right.
before they opt for the procedure. In other words, they're always looking for the fast way out. And I think part of the reason is we've done a really bad job as clinicians to incentivize them to do that and come in and be done really, really fast.
Mm-hmm.
And that's a problem.
Yeah.
And I think that's a problem of the centralized mindset. I think that's how we got into the problem with obstructive sleep apnea.
I agree. The idea that that you and I can fix people just with our hands is like, it's kind of ingrained in us, but it's completely not true.
Well, it's true up to a point. Like, I will tell you, the part of neurosurgery, even the part of dentistry that I completely am okay with. For example, oral surgeons fixing facial fractures. That absolutely is.
You got to do it. Trauma.
You not only got to do it, but needs to be done. And the stuff with me with acute trauma in neurosurgery, that stuff needs to be done. But what we're talking about is the chronic disease. That's what was really in the Gooby Dooby thing.
Mm-hmm.
That he really didn't understand. Brain surgery without a scalpel is possible, just like dentistry without a drill is so possible.
Right.
But the thing is, you as the dentist or me as the doctor have to understand that photonics electronics is the base. It's not the biomechanical.
Right.
That's the base. And unfortunately, we're all taught the biomechanical mindset, like the engineering mindset. And like when an engineer hears this is the reason why engineers, even electrical engineers, don't understand quantum biology, because it's not just the story of electricity through the use of semiconductors. It's actually photonics, and that's really not their domain either. That's the reason why they have to make a quantum leap as well. But I think dentists and MDs have to do the same thing. And when you realize, you can still do root canals. You can still use, different cements over the dentin to calm shit down, but give the patient a chance to try to get better before you, run to do an endo, saying, especially in a difficult tooth, say like you do a first bicuspid with 2 roots, or, a first molar upstairs that's got, 4, 5, 6 canals.
Right.
I just think that we don't do that. And I think because those procedures have become so lucrative, like when I was in dental school, those were not lucrative. And now they are. And now the real problem is dentists are trying to get away from doing root canals because root canals have such a bad mojo.
Right.
Let's just take a fucking tooth out and put an implant in. And I'm like, okay, well, you just went from the frying pan to the fire,
right?
And you don't realize what you're doing. But why is everybody in dentistry opted for that? Because it's way more lucrative. And why do patients like it? Because I can fix this problem. I don't have to cut down my other teeth, and I don't need the prosthodontist. And
right.
But the problem is nobody actually has these discussions with patients. Like I never talk about them because I don't do it anymore.
Right.
But I've had a couple of farm members
Hmm.
who's had this problem, and I've had to educate them on why they're hearing what they're hearing from the system
Right.
and how they need to think differently about the system. Uh, I even had one of my former colleagues who was a dentist who wanted to become a farm member who I wouldn't let become a farmer because he was so centralized in his thought process. And I'm like, I don't think you're ready for me yet. I think you need to do a lot more homework first.
Yeah, I'm uncomfortable with the whole like the holistic dentistry world of you know, amalgam removals and root canal. I mean, I've had patients come to me with their physicians telling them to take out 4 teeth, because they have root canals and they have like, you know, of infection, and then and then they get to the whole story like it's a dead. They read online that a root canal is a dead tooth, and it's like,
It's just
well, based on our discussion of Leonora's work, I mean, if it's in there, there's still fluid flowing in there, and if the body can actually get in there, if you get your environment right, the body will take care of the infection that's in this tubules, because really it's the dental tubules that are the problem.
yeah,
And so
but you never hear that. These functional dentists got their ideas really from the Western A. Price
they did,
Foundation.
they did, yeah,
And I'm just going to tell you, the food gurus are always the source of bad information. And I always say that, and they hate me, but it's the truth. If you hire idiots to give you advice, you are going to get the advice you paid for. It's as simple as that. And I just can't stress to people enough. If those people that you're relying on expert opinion are operating on a level that is not at the most fundamental levels, then you get what you deserve. And I'm probably going to tell you something you're going to be surprised at. If I was a dentist in your shoes and a functional medicine doctor said, take these 4 teeth out, I would sit the patient down and discuss everything that you and I have just discussed.
hmm,
If they told me they wanted it out, I would say, okay, I'm going to write a letter in your chart saying I recommend against this, but I will do it for you. Why? Because I believe that they should get the punch in the mouth. Okay. It's the only way people are going to learn. And believe it or not, in the law that I wrote for El Salvador, that's actually part of the system. Like, not only are the clinicians going to be decentralized, but so are the patients. That means if the patients make a bad decision, they are going to hang by their own cross.
hmm,
But we're going to tell them they're making a bad decision. So if you say, okay, I want my rectus abdominis hernia fixed, and we're telling you you need to get out in the sun more and change your skeletal muscle fiber type utilizing UV and infrared light, and they say, no, I really need it fixed now, sign a piece of paper, do it. When it doesn't work, you don't have any fucking claim, against the doctor for a mesh repair because you fucking asked for it and you got informed consent.
hmm,
I actually am okay with that from a
right,
decentralized perspective.
right,
And I'd be also okay with dentists from a decentralized perspective doing the same thing. Like, you're not going to get penalized
right,
as the clinician, but the patient will. And do I believe ultimately when patients begin to understand that they're their own worst enemy, that's actually really how the system begins to morph because they're going to want clinicians that do this. And then they have to realize they have to be adapted because most of them don't understand. They've been conditioned by the centralized system to go in and say, yeah, my kid's got an earache, so I want antibiotics and I don't give a fuck what you say.
right,
You educate them, they don't want to do it. And then, when no antibiotics work, now you know why. Because all
right,
these mothers, just want to spend 5 minutes in the doctor's office to get amoxicillin or augmentin for their kid, who's got an ear infection.
right. So for all my friends who don't know about ATPase and ROS and RNS, and not that I'm like an expert on it at all, I know what they are, and I actually have gotten enough to know that I think the too much oxygen is the problem, and like say us in a person that we've expanded. So what's the TLDR like on like so the root cause is basically blue light, melanopsin destruction, and decoupling of vitamin A, right? Which actually then breaks down all those pathways, right?
Well,
Is that pretty
it
much
breaks down the opsin pathways that are designed to work with the light that's being created. So then what did you just do? You completely made a new light story in those tissues.
Hmm.
And that new light story, especially if it liberates more ultra weak UV light, sets them up for oncogenesis. Why? Because we know that you have to have UV light to get past the stage of mitosis. So what does that? What creates ultra weak biophotons in the UV range more than anything else? ROS and RNS.
Right.
What else does it? Excess ATP.
Hmm.
Those are the two things that actually are the precursors at the photonic electronic level that actually lead to aberrant electromagnetic function in our tissues. That's actually fundamentally the real metabolic cause of cancer. It's not what Thomas Siegfried tells you.
Right.
It's not. Anybody who thinks a Warburg metabolism means pathology is an idiot because they don't know anything about the fovea of the eye. The fovea of the eye is designed in every single human on this planet to work via Warburg metabolism. Once you know that fact, then you can't run around and tell everybody in the world that cancer is always tied to a Warburg metabolism. That
Right.
means you know this much and you become even more dangerous.
Right. So, so then, like all my like, well, this was like this happened to me. So I wore a CGM a year ago, and I actually quit like in the fall, and right before I found your podcast because like it would just spike when I walked into my office, and so I mean my office is a blue light hell. I mean what dental office is not a blue light hell? I mean what hospital is not a blue light hell, right? And so then I really didn't put the pieces together until I listened to Max's podcast with you, his first one on light, when you went through the whole, like the 3.5 hour one of the whole Palm Sea story. And so then
That was when he was still a food guru
that
and
was when he was a food guru.
kept
Yeah.
interrupting me and arguing with
Yeah.
me. It
You
just
did.
got me frustrated, and I said, "I'm done."
You done. Yep. And then I listened to Huberman. And you know what's interesting? I actually found you through Max because I was actually in a visceral fat met WhatsApp group with I ended up in there with Max because I was thinking I was seeing all these problems, these things that weren't working, like on my patients. Like we were expanding people and they were not getting better. And I was thinking, is there visceral fat like in the pharynx? Is there what's happening in the pharynx? What's happening in the tongue? And so I was actually going down that rabbit hole. And then I actually don't believe that could be a secondary or third tertiary effect, but I actually believe I don't think that's actually the mechanism now. And so like the whole Palm Sea story, and I mean, people just have a hard time understanding that blue light actually create, boosts glucose and insulin, and it's like you just basically have to look at the data that it does, and I think
Do you know what glucose does in the mechanism I just told you? Do you know that it quenches
yeah,
ROS?
right, right. So
Think
that's
about that for a
yeah,
minute.
yeah,
So when you actually add that into this, how shall you say, discussion,
yeah,
you begin to go, how smart is the body to know that when you're inducing bad light, it's trying to offset
right,
pathology that changes the biophotons. That's how much wisdom is in the tissue. And the thing is, when your clinicians don't know that, and then they do things, this is the reason why I tell everybody if you take a supplement for a problem, it's just like putting a palatal expansion in somebody. You'd have no earthly idea what you're doing.
right,
You can actually make the situation worse. And I think it's incumbent. The only way doctors are going to stop doing this crazy shit is when patients understand that these guys really don't know what they're doing. And they're going to be like, hold on, before we go and do this, ask the doctor questions like what we're doing right now with each other. Just like what you said, you're in that group and you realize through empiric evidence of what you were doing in your practice didn't work. To me, that's a sign to every patient. I need to go see this guy because you know what? He is not going to treat the world like a nail and he's the hammer. Because
right,
that's what you get from the Peter Attias of the world or the idiots that want to take everybody's amalgam out.
right,
That's to me really important. That's why I told you the story about my biochemical training in dental school. Those guys told me the same thing. They were like, I got to teach you this, but I'm not buying it. Like when somebody says that to you, you
right,
kind of go, wow, that's a level of respect because they're telling you up front, I don't know everything.
right.
but I know what I'm getting paid to teach you, and I'm going to teach you this.
Right.
Uh, that facilitates an open mind, in a student and a clinician. And I think that's the same story that you just, reiterated to patients who probably come to see you, because you're questioning things. You know that the things that you've done in surgery, or the things you've done to help people with apnea haven't helped. It's the same thing. Let's tie a circle on this one. It's the reason why I think the Doobie Gooby video is pathetic. Why?
Right.
Because he just quit.
Right.
Fuck
Right.
that. I'm
Right.
like, I don't want a guy. I'm glad he quit. You want
Me
to know the
too.
truth?
Me too.
Because
I
he
mean,
was he never really got interested to figure out why.
I
He
can.
said, "Oh well, people that go outside and eat vegetables, tend to do better." But I mean, then you're gonna have all these vegans say, "See, Doobie and Gooby told
Right.
me,
Told me
to
to do
eat
this.
like a rabbit and I'll be fine." But you're not a fucking rabbit. You don't have
Right.
a bushy tail and big ears.
Right. I mean, I have two thoughts on the Gooby story. I mean, I kind of agree with your last comment there. It's like he's doing nothing to solve it, but I can also agree. I mean, we all kind of have like mid-career crises in our work. I mean, it's being clinicians is always it's stressful, and so I mean, I can actually get there was times when I wanted to quit. Um, but I think ultimately you have to find out what is your purpose, and I think ultimately, you know, my wife always just tells me that I go down rabbit holes and I just end up in a rabbit hole. And I think I've actually found the one rabbit hole that actually makes the most sense to me because this is ultimately the key to all life, which is light. I mean, if we
For
don't
me,
solve,
it's different.
you know,
I'm pissed off. I'm still pissed off. Pissed off that I was lied to when I was in school. And I got news to you. I don't think I'm going to stop until all the truth is elucidated.
I think,
Um, that's really, I'm not kidding you when I tell you this. That's the difference between me and Gooby.
hmm
There's no way I'm quitting. Even if they take my ability to do surgery away from me, oh, I'm lit up like a Christmas tree, my friend.
hmm
No, indeed. I believe, I believe, once you know the truth, it's hard to go back to sleep. Then you have to do this because you're passionate for the truth.
hmm
And I think the sad part of the centralized system, to take a clinician out of that, just as you said, what is the major feedback loop for you as the clinician? You do what you're taught and find out what you didn't work, then it's incumbent upon you to say to yourself, why?
right.
But guess what? That's not what we teach people to do. But that's effectively what happens when you get out of residency or out of school and they say, go ahead, go to work on the public. Here's your license to do that.
hmm
And I think understanding those fundamentals, and then the patients need to understand how they've been conditioned. It's no different. I think patients in centralized medicine and dentistry are just like sending your kids to public school. They have a set of beliefs that are fucking horrible too,
They
and
do.
they need to be retrained.
They do. It's
So
incumbent on us. I mean, the one difference I will say with between dentistry and at least medicine, from my standpoint, is I think dentistry has a better chance of being able to, you know, get, you know, changes and, maybe.
no, I totally disagree with you. I think the ADA and the AMA are brothers from another mother. They are centralized as
Agree.
all get
Agree.
out, and they make tons of money from their corporate partners. I will tell you, in my opinion, dentistry is so knee deep, just as drugs are. Like, for example, the use of fluoridated toothpaste is equivalent to big pharma's loading up every freaking pill with fluoride.
hmm
Dude, that's the single biggest problem that is so hidden from people. They don't understand. Think about what we just spent this whole podcast talking about. We're
hmm
talking about ROS. We're
Yep.
talking about oxygen being the most biologic electronegative atom on the periodic table. What's more electronegative than oxygen? Fluoride.
Right.
In other words, you don't make any ROS. Like, for example, do I believe fluoridation is one of the things with blue light toxicity behind type 1 and type 2 diabetes? Yeah, you know why? Because type 1 and type 2s don't make any superoxide pulse.
Mm.
Well, if you don't make any superoxide pulse, what does that mean? Something is acting as a giant sump in the system to keep oxygen down. Guess what I think that is? Fluoride. I mean, think about Ketac cement that I remember
Yep.
learning about in dental school. What
Glass
the hell
ionomer.
is it made out of? Glass ionomer cement is loaded with fluoride.
Right. And that's
You know,
that's actually the
how many
selling point.
amalgams? Yeah, how many amalgams is that sitting under? You know,
That,
and we're blaming you got the Western A price idiots out there
mhm.
blaming the amalgam and not realizing that just about every big amalgam with more than two surfaces probably has Ketac cement underneath it,
Right. And when
or the
the
freight
and,
cements that we used to cement, you
mhm.
know, post and cores and crowns with,
Right.
also has fluoride in it.
Yeah. So like, yeah, and so there's probably zero amount of fluoride that is acceptable, probably, and on those terms, on the biological level. I mean, so
Well,
even
well, if
if,
you
if
understand photoelectrically what fluoride does, I mean, you know, let's get to the crux of the matter of really what I said to Rick and Huberman. If you accept that we are a system of semiconductors that basically collects light, and you understand that semiconductors move light throughout the system to do different things, fluoride basically is a dielectric collapse. In other words, it pulls all the electrons out and stops them from moving. What does that mean in the system that I just told you? It means it's the off switch for the entire system.
Mhm.
You know, it's actually a way for you to think about it. Fluoride in um, a system built around semiconductors is equivalent to what cyanide does on the inner mitochondrial membrane.
Hmm.
That's how I think about it.
Mhm. So yes, so fluoride
Every time
treatments.
you pop a supplement, every time you get a molecular hydrogen machine, ask yourself this question: how much fluoride do you think the manufacturer went and when they did their testing? You're going to find out as much as the people in Flint, Michigan did on the water.
Right.
None.
Because you've
And
actually said that it can't be really be even removed from, like, with RO units and stuff, right? It's almost impossible to get it out, even if it's naturally
oh,
occurring.
yeah, and that's part of the reason why there's certain places in the world you really don't want to live. Like I said, I just did a consult with a guy right before you who is from Yuma, Arizona, that has got a very specific problem. And I told him, I said, you're not getting any better there. And I said, yeah, the desert is loaded with sun, but it has no magnetism and shitty water. And I said, let me tell you something else you haven't thought about. What's the real geopathic stress for that area? The whole water from the Colorado
Mhm.
River goes through rocks that are the most fluoridated rocks in North America. So that means all the water is fluoridated naturally. So if you want to know why California is so fucking stupid and does the things that it does, from my opinion,
Mhm.
I think fluoride has a lot to do with that. Why? Because all the water for California, literally, I guess for the last 55 years, like Southern California doesn't exist. Or like, here's even something better. Why am I telling you this? You're actually at the end
Uh,
of the cap system. Right now, that water rights is being negotiated as we speak right now.
mhm.
Las Vegas doesn't exist
Right.
without the mob doing what they did
Yep.
to secure water rights for that oasis in the desert. And just remember, every single bit of water that comes into Las Vegas, whether it's piped in
Mhm.
or whether it's brought by a well, is probably got more fluoride in it than the gel that you use in trays in your practice.
Right. So I think that's true. I think it's probably true. And then we add it. Then there's the city municipality adds more to add 1 part per million. I mean, that's
Think
just
about it. I don't have to tell you. You're a dentist there. Maybe then you'll understand why people are not for Bitcoin, why people are for casinos, why people are for big labor there, why people supported Harry Reid so long, and then why you have so much in common with Los Angeles and why the I-5 connects the two cities
right.
and why everybody likes Vegas and everybody likes LA.
Right.
Maybe there's a tie there to dopamine because you can't make any
Right.
because everything's being sucked out by a dielectric collapse of the water in the system. I mean, but then we have Sally Fallon say, no, it's the seed oils. It's
Right.
this, that, and the other thing. Like, this is the shit that just, it absolutely pisses me off that we can allow stupid people to affect the public health the way in which we've done. It's so much more simple. There's a reason why animals don't go to Las Vegas. There's no fucking water or magnetism there. Only stupid humans would build a city like that in the middle of Nevada.
And a few bighorn sheep. Um, so I mean, what's interesting about the fluoride story is I've never actually seen it actually in my own personal practice. I've never actually seen like, patients would, request a prescription for it. I've never actually seen it actually slow down their tooth decay. So it's not like in my eyes, I've never actually seen it actually, be that efficacious,
Well,
you
I'll
know.
tell you one of the things that I did when I was in Nashville. This is a long time ago when I was practicing, got me into a little trouble. I'll tell you the story. The hospital system that owned the hospital wanted me to do bone biopsies because it increased their reimbursement through Medicaid and Medicare.
Mhm.
And just by them telling me that, that was against the law at that time. But I didn't think it was a bad idea, but for a different reason. I didn't care about the increased reimbursement. You know why I did it? I said, is it possible that if I do bone biopsies on all these kyphoplasties, that I would find out that really osteoporosis, the most common cause in the United States, is probably fluoride in the bone.
Mhm.
So when I sent it off, I started, sending it off for fluoride. And guess what I found? About 90% of people with the worst cases of osteoporosis, those are the people you're going to do a kyphoplasty in, their bones were loaded with fluoride. And then I started talking to my orthopedic colleagues. I said, have you guys ever thought about, people who get fractures that shouldn't have fractures? Like the most common one that I thought about with this kyphoplasty thing was the issue with Colles fractures. Everybody knows Colles fractures are linked to old ladies with osteoporosis. So I got a couple of the orthopedic guys saying, that's kind of an interesting thing. And the reason I'm bringing this up to you now as a dentist, I've had this sneaking suspicion that all of the osteoporosis meds, I've looked into it, they all have fluoride in it. So you know that they get that crazy change, like we see it classically in Fosamax with the jaw.
Mhm.
I actually have always wondered if those problems were always related to the drug and not the original disease, like it was a fluoride problem. Now,
Mhm.
I was already out of the oral surgery game at
Right.
that time, but I talked to several of my oral surgery friends, and one of them, who I actually just talked to yesterday about something completely different, uh, he said, "Yeah, dude," he goes, "We're not going to send stuff off like that because if we do that, we're going to have huge problems with the hospital system." And as you know, oral surgeons already are not treated, as first world doctors in a hospital anyway, because
No.
because of the MDs,
Right.
And this guy, ironically, he trained with me at LSU. He has an MD and a DMD, like I do. And when I pointed it out to him, he goes, it's a really interesting, idea that you're presenting here. That actually, it's a complication of the pills that big pharma is selling to primary care doctors for osteoporosis. And I actually think that people will find out that it is, and it's very easy to prove. All we because we have so many people on these meds,
Mhm.
and then when you think about how these meds also affect the gut barrier, like a lot of the gastroenterologists I've talked to, I said, "Have you seen problems with gut barrier problems with people on the osteoporosis meds?" And they're like, "Yeah, it's amazing how bad some of these people's gastrointestinal systems are, but nobody's making the link." And remember, how are you taking these pills? You're taking these pills, through the GI system. It's got
Right.
to get a pH of 1 or 2 at the gut. I said, "Do you know what happens with fluoride when you put it in a pH like that? It actually becomes even a bigger problem." And then, most people I think know when you heat fluoride up, they know it from Teflon pots,
Right.
that it also becomes a big problem. And then you're scraping that shit off, and then it's a bigger issue. But everybody keeps blaming the pots. I think the bigger problem is actually the drugs.
Mhm.
And I think this is the reason why many of the drugs and many of the supplements lead to even bigger problems than they aim to solve. And why is that a good thing? From a big pharma perspective, think about what Borla just came out with the COVID shot. He said, well, the COVID shed has a problem, we'll create, a new class of patients for us to treat. So now they're going to have all these people with these cancers and long COVID and all this stuff. They actually don't have a fucking problem with it. Why? Because they know that nobody in the research is going to be studying things at the photonic or electronic level. And this is how they can operate with impunity. It's almost like the whole business plan of big pharma and, big dentistry is they act like a stealth bomber. No one can ever figure out really where their disease inducing, blunt tools are located, because it is a blunt tool. It doesn't have to be that big a deal. And I can tell you, this idea with fluoride really started, with Rockefeller and the Nazis.
Right.
Rockefeller got the idea from the Nazis who were doing this. And it makes people more docile. And, sorry, the helicopter landed.
No worries.
People don't realize it makes you more docile. And the reason I bring this up to you is it's because of what I said about people in Nevada and in Los Angeles.
Mm-hmm.
They don't really understand that this affects the dopamine reward tracks in their brain. Why? Because you're not able, through semiconduction, to optimize melatonin or dopamine, which requires that optimization to fix all the opsin system that you asked me about earlier.
Right.
So when you realize you completely break how the cell will refix this system by adding, the poison, which is the antidote to a semiconductive system, that's how I look at fluoride.
Mm-hmm.
And this is the reason why I would tell you, I totally disagree with you. I think the ADA is as bad as the AMA. And I think I'm probably going to offend you when I say
Oh,
this.
no, go ahead. Yeah.
I think I can offend you because I hold the same degree you do.
Yeah.
I think dentists are more ignorant than MDs are about this. I think more dentists, or I should say MDs, are beginning to realize that fluoride really is a big problem. But dentists don't want to talk about this because they're afraid of the pushback they may get on their licensure. And you have to be because of the Dental Practice Act in every state is different, just like the Medical Practice Act is. Right. And I can promise you, if you start pushing this agenda, they are going to come visit you. And you guys, as dentists, have already seen, what they've done to like guys like me,
right?
To Mary Bowman, Corey, what's his name? Dr. Merrick,
yeah,
they go after MDs. Like COVID was a real eye opener for MDs because they realize even when you tell the truth, you get punished by a centralized system.
Right.
And I think dentists have learned, we're not going to rock the boat. Why? Because we don't have a big system behind us. Medicine has. You guys are truly independent contractors. Insurance has never really worked well for dentistry.
Nope.
And I personally think once dentists understand this, I think you guys can be soothsayers because the patients will appreciate this. Like for you to go out and tell people, I don't want you to go to my competitor down the street, have all your amalgams out because I think it's completely superfluous.
Right.
Now, if you're the dentist that says, but I will tell you, tooth 3, 6, 9, out of all of them, those need to be done because based on your history, you have P-tax cement underneath those, and I want to remove the fluoride. Okay, bro. Then now we're cooking with gas.
Mm-hmm.
And most dentists, when they document, they don't even put down what kind of cement they used in restoration.
Right.
See what I'm saying?
Yeah, for sure.
But you can get a hint of it, when you look at an x-ray, like a bite wing, say, there's a big radio density or radiolucency underneath this, and it doesn't appear to be consistent with decay. This is probably cement that's overlying a dentinal cap.
Right.
Dude.
Which is then leaking through.
You're that dentist, then I'm okay with you, because if you remove that fluoride, you may have figured out why the tooth has got a problem.
Mm-hmm. Yeah, I think you're right. I think most dentists fly under the radar. I mean, there have been some dentists that are, on the holistic, angle that have gotten themselves in trouble. And I think, most of us kind of fly under the radar by, you know, being open, trying to be open and honest about, what are the pros and cons and kind of go from there. I mean, that's how I try
I
to do
look at the guys. I looked at the guys that have made a career out of taking amalgams out of people's mouths. Just the way I look at plastic surgeons
it.
that do face jobs and tit jobs.
Right.
They're not really doctors. They're
Right.
basically vanity experts,
Right.
and they're pushing an agenda that is popular with the public, but actually really hurts them. Like plastic surgery fundamentally, and I'm talking aesthetic plastic surgery, is absolutely one of the most useless things that American women and American men have adopted. And I feel the same way about removing amalgams.
Hmm.
I don't think there's any difference between those. And I think I'm never going to solve that problem because I think those things become more popular the lower people's dopamine and melatonin levels get. And since we now live in a world that is all blue lit, RF, and microwaved, you're
Hmm.
always going to be in a place that destroys those systems that maintain your dopamine and melatonin levels. So I have chosen, like, if I was a dentist now, I would not practice in Las Vegas. I would not practice in LA
Yeah.
because I know that the moral problem, I would be too aware of it. Like this is one of the things that the Doobie and Gooby guy said that I respect him for. The moral imperative is why he's stopping. Like I would probably move to another place to do my thing, and then I would probably go to Los Angeles and Las Vegas and tell everybody there's a reason why these aesthetic dentists and cosmetic dentists are so popular in these cities. And maybe you need to realize that. Now, that won't make you a really popular guy, at the conventions or with the guys that sell things. But ultimately, I think you have to decide as the clinician what your moral hazard is and then really how much you want to do things. I mean, I understand fully from a capitalist perspective that could really screw you over. But let's put it this way. Say if you're a dentist and you already made a good lifestyle, do I think older dentists could actually teach the young guys a couple of tricks? Yeah, I think if we want to make the profession better, I think we need to tell the truth because you know what I believe? I believe there's always going to be women and men
Hmm.
that put vanity above health. So you're always going to have a strong business model.
Right.
The difference is, I believe you just need to have a warning sign in your office saying, what I do could be detrimental to
Hmm.
your health. And you just need to be aware of that. If you're able to jump over that threshold with me, then come sit down and I'll tell you about the chiclets I can put on your teeth
Hmm.
or, the implants I can put in you, or I can give you as nice looking teeth as those fake breasts that,
Right.
one of the doctors from Bravo put on
I mean, there are people for whatever reason who, bad choices or bad luck or whatever, who end up with, destroyed dentitions that need to be restored. I mean, so that's always going to be that's always.
med addicts and things like that, or children whose mothers were dumb and put, the baby bottle in their mouth while they
Right.
put glucose in. I totally agree with you. It's just the same argument that I would make to you about, trauma.
Hmm.
Trauma always has a place. Like
Right.
plastic surgeons that do free flaps for trauma, I respect them tremendously. Their skill set is amazing.
Hmm.
But what I'm talking about guys who basically do nothing except inject
Right.
Botox, lip juice to give them, the blowjob lips and fake tits. I mean, I just don't know how you do that shit all day. I
You know
mean,
what?
you're
It's really interesting.
low agency people.
It's
I've got friends that I went to dental school with that honestly are cosmetic dentists, and
Yeah.
that's how they make their business.
Yeah.
I'm like, bro, how do you do this? And what they really tell me is they divorce themselves from the moral hazard because they're like, well, the patients want this, so I give them what they want.
Right. I
I
mean,
can't do that. I don't have that. I don't have that. I guess I don't have that histone acetylation that allows me to do that, because I would be pissed off if I had to do that all day. And personally, Doug, I think this is the reason why that so many doctors and dentists are burning out now, because I think a lot of them don't realize that they are professionally dissatisfied because they know that they're doing wrong, but they're printing money, they're paying for their third wife, they're paying for the Mercedes payment, they live in a 10,000 square foot house. I'd even say there's some of them out there that are doing it to buy Bitcoin, by fiat farming.
Right.
And ultimately, I'm also a believer that I am a capitalist. I don't, begrudge Mark Cuban or Dave Asprey or Mark Sisson from making the money they're making. If people are stupid enough to pay for it, I'm okay with it. I just think that I'd like to see, in all of their offices, or like Peter Attia's office, or Huberman's podcast, or even Rogan's podcast, the warning that what you may hear here may be detrimental to your health. And if you employ this through biohacking, mitohacking, realize that's the case, do your own due diligence and go from there. To me, I think that's the perfect warning. Then I don't have a problem with guys, using incentive codes and affiliate codes and all that, because you've actually done your audience the truth. You've told them, look,
Right.
I may be a fucking snake oil salesman because I don't know enough.
Right.
And you need to fucking augment your knowledge to see if buying my vibration plate is a good thing or a bad thing, or buying, my next supplement or my next peptide, that because I went to some wackadoodle in Florida,
Right.
That is selling you this idea. I don't have a problem with that. Just like I think the patients, when they do get sick from stuff like that, I put the blame both on the doctor and the patient. I don't ascribe blame just to the doctor alone. But I do think that patients need to understand, if they want better doctors and better dentists, they have to do a better job
Yeah.
of really doing due diligence to put our feet to the fire.
Yeah, I'm a little concerned about the exosome world and like the peptide world. I mean, I'm a little it's there are some in my industry that are going head over heels into it. And I'm a little I don't think we know enough to understand the science behind what it is that's going on there. And that's
That's where snake
very
oil
expensive.
salesmen win. Don't you understand that? Opaque markets. This is part of the reason why I don't really. I've probably picked on Peter Attia probably too much. I probably should start picking on Tom Cowan a little bit more for some of the stuff, that he's slinging out there,
Yeah.
or, Thomas Siegfried, on the metabolic side. I don't think I need to do that. I think my better role is to point out to the patients that, hey, what these guys are telling you, part of it's true, most of it's false. You
Mm.
need to understand why. And I think the future is going to be done by like doctors like Dr. Alexis Cowan,
Mm.
who's got credentials out the wazoo, even better than Huberman. She's trained in, the Princeton Rabinowitz metabolic lab, but now she's beginning to realize light is the biggest missing piece in that whole paradigm. You get a PhD researcher like that, she starts getting private funding, from big donors, and she's able to do the studies like you and I are just talking about say Ketac cement
Right.
or fluoride in supplements,
Right.
and we get, brisk data on this stuff, bro. That's how we change the world, because guess what? Then the medical students or the dental students in school don't learn the bullshit that you and I learn,
Right.
and we don't have to do podcasts like this to hypothesize why people we're doing stuff to are not doing well.
I
In
want
other
the
words,
I want the EMG studies in the tongue and the pharynx. I mean, that's that
right,
I want that. I
right.
mean, like,
Well, that
well,
gives you a big clue of really what's going on. And I think, though, I mean, we're at such a basics that, like, when I mentioned this to Alexis not that long ago, I said, look, people don't realize the electric side is the ATP side, the magnetic side is the ROS RNS side. And it turns out the ROS and the RNS side is the timing of the metabolism, which explains to you why all the different metabolic pathways in biochemistry have different ATP levels that they make. I mean, you think about how basic a question this is. Have you ever sat in there when you were a dental student learning all this and go, yeah, why is it that beta oxidation makes so much more ATP and only has these small little amounts of ROS that's made.
Right.
That should actually tell you something. But guess what? It never told anybody anything because you know what? The people teaching you never told you that, and you never thought about it. And until you have feedback of being in practice for maybe 10 or 15 years, you start going, yeah, why didn't I ask that? Why is there so many enzymatic steps and beta oxidation to get pyruvate into the TCA cycle? And why does it go through all these crazy steps? Then when you find out it's to eliminate deuterium and keep hydrogen cycling through NAD positive and NADH, you go, son of a bitch, the wisdom inside a cell is remarkable.
Mm-hmm.
I mean, it is absolutely incredible. And it turns out that it has a quantum specificity. It goes all the way down to the atomic mass, the kinetic isotope effect, the magnetic moment. And, you know, when you point all this out and people fact check you and they go look at it and like, God, he's right. That's the difference. Then
Right.
you start to go, okay, what else have we missed?
Right.
That's really, I look at my role. My role is to be the guy that sees the invisible, and it turns out the invisible is the most important part
Right.
of the story that none of us were taught. If I can do that before I'm dead, then I think that's what separates me from Doobie and Glooby.
Yeah. I mean, I think
Doobie and
you're,
Glooby now that he's got free time, maybe he gets involved,
yeah.
you know, in this whole battle, because I do think he's been punched in the mouth enough where this kind of stuff may really interest him.
I mean, we need people like that we need smart people, way smarter than I mean, my head's spinning a little bit when you start going down the biochemical pathways and the photons. But I
Yeah,
mean,
but you're smart enough because I'll tell you why I disagree with that. I think you're smart enough because you already said by your own admission, Jack, I did stuff on people and it didn't work. So what did you do? You didn't do what the plastic surgeons in Las Vegas were doing, who keep putting 400cc implants into strippers.
right.
No, you said I need to think about this. I need to think about this differently. So I'm going to disagree with you. I
Yeah.
don't think you need to be the expert in the biochemistry thing. I think well, all you need to do is know what you already know. Say, so it turns out the level of ROS and RNS and the level of ATP have some kind of link to the light environment we're in. Now that makes some sense. And you already know through the centralized peer literature that those who use CPAC machines for some reason get more cancer than others. Well, guess what? You haven't heard a better plausible explanation for it than on this podcast I did with you.
Right.
So guess what? I want you now to question Uncle Jack. I don't want you to believe anything I told you today.
Right.
I want you to go and fact check me. Just like I told you I do to patients,
Yep.
I expect other doctors to fact check me. Why do I have a big smug smile on my face? Because I've already done all this because I didn't believe myself.
Mm-hmm.
Okay. I
Right.
didn't. I've never believed myself on anything I found.
Right.
Because I believe that's the feedback mechanism you have to challenge your own Dunning-Kruger moments.
Right.
I know what you're going to find. That's why I smile when I do these podcasts.
Right.
But you need to do that because then you're going to need to teach your patients the same thing because they're going to believe everything from your competitors who are dumb fucks.
Right.
Okay. And I'm going to be that guy on Twitter that keeps doing that. A guy like you is nice. You're not going to go call your competitors down the street in Las Vegas a dumb fuck. But, I'm at the end of my career and I know that centralized medicine and centralized dentistry are filled with 98.5% dumb fucks who don't question a damn thing.
Right.
So I have to be that guy that constantly punches people in the mouth, even people that I like who are doing, say, 70% of things right. Like Joe Rogan, he's still a fucking shill for the centralized paradigm. Same thing with Peter Attia. Peter's a smart guy. He just doesn't know what he doesn't know.
Right.
Alex Cowan's a smart person. She now knows what she doesn't know. And you know what? Let's let her go.
Let her go.
Max, the same way.
Right.
Max now is starting to get it.
Max is getting it. Yeah.
Right.
Max is he's on the road. He's on the
That's
path.
all we need. So
Right.
Max is going to be able to go out and, be the viral infection for the people in Australia. Australia is more centralized than even the United States.
Right.
So Max has a way steeper mountain to climb than I think I do. But remember, I've been climbing this mountain in the United States for 20 years. And it's
Right.
only now that everybody around the world is starting to wake up to the things I've been saying in the United States, which gets me back to the doobie and gooby guy. He can
Right.
only affect people in his local environment. Brain surgery without a scalpel affects everybody in the world.
Right.
That's the real reach of a neurosurgeon who's put all this stuff together. And I think we can have a massive impact on the world. And I believe that COVID was the trap door. While everybody looks at it as bad, I think for me and the science that I'm bringing to the world, I think COVID was the best thing that ever happened to me.
Right. Oh, for sure. For sure. I mean, that pretty much, put you back square in the like, let's listen to this guy because everyone else is lying to us. It's like,
Well, I mean, anybody look, but when the public health people came out and said, let's go inside and stay apart 6 feet and nobody can go to the beach without getting arrested, I'm like, bro, you are being led by a criminal cabal because they are basically preconditioning you to the vaccine. That's
right.
what that's what all the public health idea was about.
Hmm.
The more sick we make them from the manufactured virus we created in Wuhan with gain of function study, they will all run to roll up their sleeves so they can get back to watching Netflix and drinking coffee at the coffee shop. That you heard Fauci say that on the tapes in Congress. But guess what? You still have 50% of the country still think Fauci's the greatest thing since sliced bread. And those are the same people that are stunned that their president is demented.
Right.
So guess what? I just described to you Las Vegas and Los Angeles. Again, you're back to the fluoride story, you're back to the drug story, you're back to the vanity story. You realize where these narratives are created. They're always created in places where the environment breeds low agency people. And
Hmm.
what I'm saying to you is our profession and my new profession are no different than Hollywood. We create obedient idiots.
Right.
That's what we do. And I believe when a doctor wakes up like Gooby and Dooby have and like you have, we have a moral duty to help the public out.
Hmm.
Now, how you choose to do it is probably different than I'm going to do it. But
Right.
I believe anytime I have an opportunity to take my wooden shoes off and throw them into the clock gears
Right.
of centralized medicine or dentistry, bro, I'm going to be the guy doing it.
Hmm.
Why? You don't know how much joy I get to see paradigms that are built on lies blown up. I can't tell you how happy it makes me.
Yeah. No, I mean, I think, I mean, my partner at my office, I mean, she does some Invisalign for me and myofunctional therapy, and she has melasma on her face. And like, I heard your podcast, and I'm like, she's in Hawaii on vacation, and I'm like, I'd actually treated it a little bit. I have a laser, and I'd actually done a couple of treatments on it, which it doesn't work. And finally, she was in Hawaii, and I'm like, I just listened to your podcast with Max, and I'm like, I call her up, or it was either that one or the Mac or Rick's podcast. I'm not sure. I'm like, you have to stop wearing makeup and sunscreen, and you have to like start going and seeing the sunrise every single day. And she's like, what? And so she's Korean. And so, culturally, that's like it's been like but
Yeah.
she has not worn sunscreen since like January 1. And like, she's like tanner than I've ever seen her. And, I think her melasma spot is almost gone. She doesn't wear makeup anymore. And I mean, just the whole idea of neuroplasticity and the melanin is like such a fascinating, I mean, the fact that, I can actually understand that a little bit is I think a tribute to what you've actually shared. But I mean, it's such a
I think it's actually common sense when you actually think about it. And then the best part of the whole story, Malaz is one of my favorite stories because I like when women go to the dermatologist and the dermatologist says, we don't know what causes it, so we're just going to blame the sun. And it
right,
turns out the sun is the thing that makes it better.
right. Yeah,
That's the most ironic part. If that doesn't tell you how corrupt these people are, nothing else does.
right. Yeah.
But I feel the same way about dermatologists that do that as I do about food gurus that tell you, the carnivore diet solves all of your problems. And just that's not true
Yeah.
either.
So here's one. I have a couple of friends of mine who like they're post say they're 55 years old, they've had a squamous cell taken off their nose and they've had a basal cell taken off their nose. And I tell them about the sun, and they're just like, no, I mean I'm a skin cancer survivor. I don't wanna, and so once I go down the red light story with them and like you have to, they're like that's a hard stretch for me to get across to some of these people sometimes,
No, it's not. It's easy. I'll tell you how to do it in the future. Tell them to go back in their medical chart before they had the skin cancer taken out and see if they ever had a vitamin D level.
Okay.
Because if they did, guess what? Then you say, okay, what was your vitamin D before you had the cancer? Oh, it's low. But if you're right and the sun caused it, you know that sun makes vitamin D. Nothing else does, right?
Right.
How'd you get the cancer? Dude, this is like even a retard could figure
Yeah.
this out.
True. Yep.
Okay.
Yep.
So guess what? That is the way to pop their paradigm. And I will tell you, one of the problems I have, there's a lot of people in the functional space, but also former members of mine that are doing this bullshit with other people, telling people that sunburns are linked to squamous cell and basal cells. And I'm
Yeah.
like, that's total bullshit too.
Right.
There's more data out there that the sun improves longevity and all this. In fact, the best one is in melanoma. The higher your vitamin D level is, even if you have melanoma, you'll live longer.
Right.
So go figure that shit out. I mean, the basics are already in the dermatology literature for everybody to know that the dermatologists are full of shit. But you know what the irony is? People who live in low agency places don't even want to know the truth. They just
Right.
want to keep Netflix on, keep wearing their L'Oreal makeup, keep getting their fake tits, keeping their chiclet teeth.
Right.
And guess what? This is what I want to tell you. And this is maybe hard for you to hear as a dentist. I'm okay with those people making those decisions.
Right.
But you know what? I am going to make fun of those people. I just did it yesterday to a girl on Twitter. She's some Bitcoin person. I forget what her name was.
Right.
She posted this beautiful picture of herself, but with orange sunglasses on.
Right.
And I made the comment to her, great picture, just take the sunglasses off. You should have seen the response I got from her. She asked Dennis Porter and somebody else, who the fuck is this guy? This and that. And she goes, don't worry about me and my money. And I'm sitting there, I'm going, sometimes you can't help stupid.
Right.
And the reason I'm telling you this is why evolution has 5 extinction events. It wipes out the bad thinkers. So what I'm going to tell you as a dentist, so that you're not that conflicted, when people came to me to do elective surgery and I told them they shouldn't do it, I used to in the beginning would tell them, you can go down the street to my partner or my colleague and they'll do the surgery for you. The problem with that was I knew that I was a better surgeon than those people, and I was taking that out. I knew that I could do those surgeries better than they could.
Right.
So then I got the idea. I said, you know what? Maybe I should do the surgeries, but sign a piece of paper there up front. Tell them, I don't think this surgery is going to work. You sign it so you know that I told you that. So I did the surgeries on them. The interesting part of that whole thing, I came up with that idea by thinking about what evolution does in extinction events. Sometimes you need to give people what they want.
Mm-hmm.
That's their punch in the mouth. That
Right.
may be the only thing that gets them to go. And the real interesting finding for me is when I started doing this in Nashville, I found from about, I think it was 2008 to about 2013, I talked to the pain specialist because, when spine surgery goes wrong, they go to the pain specialist. I said, how many of my patients do you guys take care of? The answer was very few. And all my other colleagues, my competitors, had a ton. They were printing money off this. And it made me realize, even if you do the wrong surgery in somebody else, if you tell them to do the things they need to do, they won't get the outcomes that the
Right.
other people got. And then that pushed me down a rabbit hole that still uh, pain management guys didn't know. I'll give you the example. When you had a failed fusion or a pseudoarthrosis um, in the lumbar spine, if you kept their vitamin D level high, they wouldn't use oxycodone, Oxycontin, Percocet. And it made me realize that people that had higher levels of melanin were more resistant to pain. I found out it was from alpha, beta, and gamma MSH from
Yeah.
POMC.
Mm-hmm.
And then I realized about the story about beta endorphin. Beta endorphin is another one of the cleave chemicals. If beta endorphin levels are high, they didn't need pain medicine.
Hmm.
And I pointed this out to one of my better pain specialists. Like, this guy would never not tell me the truth. And he said to me, Jack, he goes, I never knew there was a link in the literature between vitamin D levels and pain.
Mm-hmm.
So I showed him about 30 papers.
Mm-hmm.
So you know what he did? He turned around and took his worst offenders of using Suboxone
Mm-hmm.
for the past 5 years in his practice. He found that every single one of them had vitamin D levels below 30.
Wow.
So then he came up with the idea to begin to supplement, like the ones that he couldn't get. Because, you know, if somebody's already a drug addict, they're
Right.
never going to go out in the sun because most of them live at night with the
Right.
TV on,
Right.
you know, or they're heavy metal guys.
Right.
And he put people on supplementation, and guess what? Turned out the people that supplemented did pretty good. And that was one of the things that got me over the threshold. Even certain people who have problems, I'm okay with using vitamin D supplementation.
Mm-hmm.
The big issue for me is that I don't think you can use this on a population basis. It has to be very specific for the problem you're dealing with, and it requires you, the clinician, to understand truly what's going on. So that's the reason why I don't recommend like the use of methylene blue or vitamin D pills to everybody across the board. I need to know a little bit more about your history in order to understand how it goes. And obviously, do I think there's less risk from using vitamin D than there is in using Suboxone? Obviously, that's a no-brainer.
No brainer.
But if you can get somebody off like 80 to 120 of Suboxone down to say 20 or 30 milligrams of Oxycontin over a period of 6 months, dude, that's a winner chicken dinner. It turns out the pain doctors really appreciate this because they're not making money off of people coming in for more drugs. Right. They're actually creating fucking nightmares for the public because those are the people that eventually kill themselves.
Right.
They're always afraid that they're going to be linked to these suicides through the prescriptions. And when I pointed this out to him, he's like, dude, you may have just saved my practice. He goes, I had no idea that that link was there. So again, it's one of those things where decentralized thinking can really help our practices and still can help our patients. They may not go all the way, but if we can get them some of the way, we still may be able to make the situation better. And no, I don't have a problem with like if you told me you were going to do implants or you're going to do chiclet stuff and all that, I wouldn't have a problem with you doing that as long as you told the patients up front, you know, what you're doing and that you personally didn't think they need to have this done. Right. And they choose to do it. I think you're absolved of your moral hazard.
Right. So here's a question. So implants in my world is like I mean, people are just dumping their teeth and just having implants put in. I mean, it's like it's like the number one thing people are doing today.
Right.
And I feel like in another 10 to 20 years, we're going to have an epidemic of all of these falling out. Because I think there's going to be lots of issues that cause that. EMF world, blue light world, you know, I mean, I've seen implants.
I think it's just going to lead. I don't think they're going to fall out. I think it's going to lead to other problems.
You think so? Because well,
yeah,
I've actually seen them fall out. So
well, I think some of them will, but I think that has probably more to do with the osteoporosis,
right?
That's induced by them. But do I think living in a blue lit non-native EMF world is going to create other problems with free titanium teeming through your system? Yeah, because I don't think people understand what transition metals do, how the D-cell electrons work in a semiconductor system, what the potential pitfalls are. It's very similar to the story I just told you about fluoride.
Right.
Like this story with implants is very similar to the story with fluoride. Fluoride is a net stealer of electrons. What titanium is doing is putting a ton of electromagnetic sensitive D shell electrons into a system, and it's putting it in a way that the system is not used to getting them.
Mm-hmm.
That is going to create another effect. And do I believe that we're beginning to already see some of that? Yeah, I think many of the head and neck autoimmune conditions are linked to the use of implants.
Mm.
Like anybody who's got Hashimoto's, I tell them stay away from an implant. Anybody who's got Sjogren's disease or calcinosis from scleroderma, I
Mm-hmm.
tell them stay away. I've actually seen somebody die, and I felt that the initial problem was implants that were placed in the lower jaw.
But
Because literally,
that'd also be the
the
same with like orthopedic implants too, like shoulders and hips and
right,
knees and even
the,
spine.
the yeah, the ortho guys though right now are in the position where they've got 50 years of their patients living in an electromagnetic environment, and their joints are falling apart. Why?
Mhm.
Because none of the people know, the fundamentals of what I told you, about electromagnetism and how it affects those two copper atoms between calcium and apatite in bone that, Becker found. And orthopedic surgeons now are cementing everything. They're screwing things in. But the good orthopedic surgeons know that they're revising a lot of these joints way earlier than they should be.
Right.
And some of them are asking the questions like you did, about the devices you're using for obstructive sleep apnea. You know what the real problem is? None of them are going to get on a podcast and talk about this.
Right.
Uh, we sit in the surgeon's lounge and we talk about it. And of course, I never try to tell them too much, because if you tell somebody that they're the cause of the problem, you're going to shut down communication. And
Right.
I'm a big believer, and I want them to continue to tell me stuff, because then it allows me to go back and build out this literature about why we shouldn't do the things we're doing. Because I really believe someday down the road, my blog and everything that I've tweeted may be the AI that comes up for quantum biology
Well,
down
I
the
think,
road.
I think, I mean, I mean, I'll be, I was a little, I did this with a little trepidation too. I have a little trepidation releasing this because I mean, it's like, it is what it is. Um, but I think, regarding the implants, I mean, I think, the orthopedists are going to say, like, look at how many lives we've actually saved by,
Mhm. And I
putting
agree with
in,
them.
and that's true. And look at all the teeth we're able to give people to actually be able to eat and
But
live.
you got to remember what I told you. This is what I'd say to them. I'm okay with you doing the surgeries, but
Mhm.
I want you to tell people to go out in the sun.
Right.
In other words, if
Yeah.
you want to make that knee last forever and them
Yes.
have less complications,
Right.
tell them still to do the right things, but they're
Right.
not doing that.
And we're not doing that. Right.
No.
And that's the frustration. That's and I when I tell people the prescription, I mean, it's like so simple and yet it's so hard, you know?
Well, because people do not remember, they've been conditioned by the tech industry to go out inside. That's what happens. That's where the TV is. That's where the radio is. That's where the computers are. You can't think about just people with
There's no
cell
way I was
phones.
doing this inside. You know that, right?
No, I mean you could, but I just try to point out to people the low hanging fruit. People don't realize how conditioned we are to be inside them. And I tell people most of our big problems in chronic disease will go away if I can just get you to restart outside and do things. Like everybody always asks me on a podcast, what is what's the number one thing that you should tell everybody to do? I say, see the sunrise. That's
Right.
like Pareto's principle. You get that right, and it's really almost hard to fuck things up from there. You
Right.
can still do it. Like if you've already got, uh, you know, say a mitochondrial disease like an autoimmune condition or cancer, yeah, you got to do more. But
Right.
that's the way to start. And I think when you kind of understand this, I don't think it's that hard to fix. And like I said to you before, there's enough people post COVID that are going to get this information. They're going to say, yeah, I'm just going to do what Jack's saying because it doesn't cost me anything to go outside.
Right.
So I can still have my knee, I can still have my hip,
Mhm.
but I'm beginning to realize that the tissue around those joints is what I should be paying attention to.
Right. Right.
And if I can make them better, then I can extend the longevity of the surgery that I had done. Now,
Right.
that's not the truth if you're talking about soft tissues, like we're talking about, say, muscle surgery.
Right.
And I'm thinking about like bladder suspension surgery, surgery for the urogenital triangle, like rectal prolapse, hernia surgery. That's a different story. But that's when dopamine and melatonin have to be optimized, and light is the biggest part of
Mhm.
that story. And no, there is no, implant. When you put mesh into somebody to fix a muscle weakness or a fascial weakness, it does not
Right.
work,
No.
the way your body works. Now, we can get somebody to be able to go back and dance after they have a hip replacement,
Hmm.
and that keeps them moving and keeps them happy. That's the reason why you don't see me pounding on orthopedic surgeons too much. But I do have a huge problem with the amount of spine surgery that both neurosurgeons and orthopedic surgeons are doing, because I look at spine surgery a lot like I feel about plastic surgery of, lip fillers, Botox, and implants. Doesn't
Right.
mean that I don't think certain people need to have spine surgery. I think certain things do have to be taken care of. But I think the major indications that guys who live in your community, they're doing surgery for the wrong reasons.
Right. I mean, it's the same thing with like TMJ surgery, like, disc surgery on the TMJ joint. I mean, it's
You don't
like,
have to tell me, dude. I where I did my oral surgery training is the Mecca. It's what
right.
John was. You don't have to tell me anything. He was one of the guys
Isn't
that,
Henry Grimming on there too? Was he at LSU? Were you at LSU or
yeah, I was at LSU.
yeah. How did you decide to become change from doing MODs and third molar extractions to start doing surgery on brains?
Actually, that was pretty easy. LSU oral surgery program was the number one country, I should say, number one program for oral surgery when I was coming out of dental school. And I was an unusual bird. I was pretty smart, and I finished dental school in 3 years. Most people at my dental school, 25%, never finished in 4 years. But I was really good with my hands, and I finished quick. So my whole last year at dental school, I volunteered to be basically an intern at LSU, and all the oral surgeons there got to meet with me. And that's when I found out that the oral surgeons at LSU do a 3 month rotation with neurosurgery. So while I was down there for that whole year, I got to see 3 months worth of, actually, it was even more now. It's close to 6 months of neurosurgery. And I remember, even as a dental intern, going in and helping these guys fix frontal bone fractures. This is a crazy story, but it's funny. I haven't talked about this in a long time. Um, the oral surgeons were using plates and screws to fix, orthodontic surgery and facial fractures.
Right.
The neurosurgeons at the time were still using wires to fucking put the
Mm,
heads back together.
yeah.
And I
Drilling holes
remember,
and sutures.
yeah, I remember as an intern, this year, I was still a fourth year. I wasn't even technically a doctor then, but I remember the oral surgery guys would leave after most of the stuff was done. They say, Jack, you put the plates on and we're going to do the next case. So I'm in there with the neurosurgeons who are like third, fourth, fifth year. And I said, bro, can you fucking stop with the wire shit? Let me show you how to use this. So I started showing them how to use the oral surgery plates and screws in the head.
Hmm.
Okay. And then one of them said to me, I'll never forget it. He said, man, we got to tell our pediatric neurosurgeons we should be doing craniosynostosis surgery this way. This would save us so much time on those little babies. And I said, why don't you let me see some of those cases? So don't you think we had a couple of those cases come up? Pediatric neurosurgeon comes in, he's doing his whole spiel. Then I showed him how to use the plates. He goes, oh, fuck, we're changing this right away. There's no way we're going back. And in that year, those guys, we cross pollinated,
Hmm.
and they started working with me a lot. And they said, dude, you're a really smart guy. You're smarter than most of the other oral surgeons that come through here. And your head, neck, anatomy like backwards and forwards, better than we do. And I told them, I said, look, my whole thing is I'm about the truth. I'm about I want to learn as much as I can. If you guys can teach me anything you can, because I believe that somewhere down the road, this is going to play a case in a role or a role in a case that I can help a patient with. So long story short, the following year, I graduate, come down to oral surgery in my first year and absolutely crush it. In that year, my first rotation is neurosurgery.
Mm.
So I'm on, and it turns out the neurosurgery program that year matched a Mormon to go to New Orleans. I mean, when you want to talk, that would be like putting, Jews in Gaza right now.
Right.
You know what I'm
Yeah.
saying?
Right. Yeah.
This guy was so mismatched for it. And at the time, he wasn't even in neurosurgery yet. He was doing his general surgery rotation in New Orleans. And the amount of debauchery that this kid saw, he basically came to the head of general surgery. He goes, look, just like Doobie and Gooby, he goes, I have a moral dilemma. He
Mm-hmm.
goes, I am a strict Mormon and I cannot get past this. So he decides to quit. So he quits uh, when he still has like 7 or 8 months left in his intern year, which is on general surgery.
Right.
But what this does, it creates a huge void in the neurosurgery program because they now have an open spot. All the neurosurgeons they could have got have already matched
Right.
in other places.
Right.
So the head of neurosurgery is David Klein. He's a world famous neurosurgeon. He's my mentor. He goes to Dr. Kent. He goes straight to Dr. Kent and he goes, Jack, because his name is Jack Kent. His name is John Kent, but everybody calls him Jack.
Yeah.
He goes, would you be pissed off at us if we offer our spot to your resident? And Kent looks at him. He goes, you want to take my best resident? He goes, we've been waiting for this guy for 2 years because we were so excited about all the stuff that, he's brought to the table and the ideas he has for research and everything else. And he goes, and Kent and Klein talked about it. And then Kent came to me and he goes, look, he goes, I don't want you to go. He goes, but this could be the opportunity of a lifetime for you. And this is a huge feather in our cap as a group of oral surgeons who just switched to a double degree program. It was an MD,
Right.
DMD program. I already had the MD and the DMD. And he said to me, he goes, I'm telling you, for my own, I don't want you to go. He goes, but you're crazy not to take this. So this is very similar, Doug, to the story I told you about being a doctor and saying, I'm telling you the truth, but.
Yep.
So when Kent did this to me, he goes, the bad news for you is you only have 24 hours to make the decision, according to Dr. Klein. So that night, the chief resident who I was working with, his name is Tom Donner. He'll probably listen to this and laugh. He's the chief resident in neurosurgery. We get called to Dr. Klein's office, and I'm carrying all the x-rays for the next day of surgery. And Tom is telling me, yeah, Dr. Klein wants to talk to us because he wants to see what we're doing in surgery the next day, which I knew was total bullshit because they never do that. And we go up to the office and Klein sits us both down and they start talking about the Mormon that got, left. And Klein says to him, he goes, Tom, we're going to have to do something. We're probably going to have to take somebody that went unmatched and didn't get through it. He goes, well, boss, why are we taking a C or a D when we have an A right in front of us? And Klein goes, what are you talking about? He goes, give it to Jack. He goes, he's smarter than most of us. He goes, this kid could do it. And Klein looks at me, he goes, son, you want to sign up for 7 more years of getting your ass kicked? He goes, I promise you, we'll turn you into a good doctor. And he goes, I've heard nothing but good things about you. He goes, I've talked to your boss. Your boss already said, if you want to do this. And Tom said, he goes, yeah, why should we offer this to somebody who we really don't want anyway? He goes, this guy did a whole year with us. Then he just finished doing 4 months with us. So that's how it went down. So I was probably the most vetted neurosurgery resident you'll ever find. Why? because I effectively did a year and a half of neurosurgery
Right.
before I ever stepped foot on campus. And that made me really dangerous
Mm-hmm.
when I switched, because guess what? I still had to do some of the things that weren't done by the Mormon guys. So that meant I had to go back and do a second intern year of general surgery. Let me tell you something. That second year, all the general surgeons treated me like I was an upper level resident. I was
Mm-hmm.
doing cases by myself. Why? Because they knew I had so much training already
Right.
and they knew what I was going to do. And then when I came into my first year of neurosurgery, some of my neurosurgery residents, they weren't very happy about it because I had already been a resident for several years. They had just had 1 year of general surgery.
Right.
So I got to do things that other people didn't get to do. Like my first day, we used to have this thing in neurosurgery. When can you do your craniotomy first? Well, I already blew that away because I did it when I was a dental student, but
Right.
they told me that didn't count.
Right.
So literally the first case I ever did on July 1st of that year, I
Right.
did with my chief resident, Daniel Kim, an epidural hematoma came in and I did um, my first epidural literally not even 5 minutes after I started my residency by myself.
Wow.
And that is kind of how my neurosurgery career started. And I loved it. I told everybody back that time, because people asked me the same question you did. I said, look, neurosurgery is just like dentistry. It's just a root canal and the
Right.
teeth are a lot bigger.
Right.
And nerve is bigger. That's it. It's
That's it.
exactly the same kind of idea.
Yeah. I think it's really interesting because I think a dentist skill is
Yeah.
it's
Well, they didn't realize that though. I was a master with the drill, even to this very day. Like certain of the things that I did, like in oral surgery, we would make Lafort cuts,
hmm
to do move the whole midface
right.
forward.
Yep.
You don't realize most of those are technically synostosis cuts,
Right.
because you're moving the face off the skull.
Right.
So, and they're much more difficult cuts than we do in neurosurgery.
Right.
Neurosurgery, to be quite honest with you, compared to some of the stuff an oral surgeon does, is fucking ridiculous. It's child's play.
Right.
But the cool part was if you put a Midas Rex in my hand, the Midas Rex was scary to a lot of the neurosurgeons because it was so powerful, but it was nothing compared to the drill that we would use on teeth. That drill, I used to tell them this all the time. The drill that we use on teeth, dude, is way more powerful and it'll cut through fucking enamel, which is way
Right.
rougher than bone.
Oh, right.
And I said, you guys don't realize, and I'll tell you where it played off for me. When I do cervical fusions, I use a drill to do the whole thing. A
Mhm.
cervical fusion in most neurosurgeons' hands is between an hour and an hour and a half for one level, with a bone graft and a plate.
Right.
It takes me literally between 18 and 30 minutes to do it.
Wow.
And the reason why is the technique. I even put the plate on using the drill. They
Mhm.
don't do that. They use hand drills. I don't. Why? You can get them in faster. And I just make small little pilot holes and then self tap
Right.
the screws in,
Right.
just the same way that we do on cranial plates or facial plates to fix a mid face fracture. And those are all changes that like I made. And when guys started to see what I was doing, many of them then began to adapt. And LSU neurosurgery has always had a pretty good reputation. Like you come out of Charity Hospital, because that's when Charity Hospital was still there, dude, there was nothing you didn't see. Like those neurosurgeons back in those days, not the ones today. It's not
Mhm.
equivalent anymore
Right.
because they closed Charity after Katrina. Um, I was overqualified as a neurosurgeon coming out. Like there was nothing my first year of private practice that scared me. And I will tell you, the first big case I ever did in private practice was with one of my partners that hired me. It was a transcallosal approach to take a cyst out of the third ventricle. When I just tell you, from a neurosurgeon's perspective, this is a kind of a scary case.
Mhm.
Literally, this neurosurgeon was 60 years old. He privately told me, he goes, I haven't done one of these since I was a resident. And I said, well, what scares you the most? He goes, pretty much the cut of death across the sagittal sinus. I said, well, I got some tricks for that. Let me show you. So literally, I come in and I do the case. He's acting like the resident. I'm the staff. It's his patient. I open it up, show him how to do the cut of death with a couple of little techniques that, believe it or not, came from oral surgery. And when he saw that, he goes, Jesus, this makes this way easier. And then I showed him how to do the split in the corpus callosum, even how to use brain retraction differently from ideas that I got from using dental rolls,
Hmm.
inside the mouth when you're going to take out a third molar.
Right.
It was, dude, this is so better because we don't have to put these brain retractors on the brain, which leads to a lot of retraction problems. And we go in and I opened up the roof of the ventricle and I said, there's the tumor right there. I said, all you need to do with this now is just take a pituitary, pull it towards you and tease it. I said, be careful on the backside because that's the hypothalamus. That's where you fucking hurt people.
Right.
And he goes, look, he goes, will you take it out? So I just grabbed the fucking thing with a tweezer and just bipolar pulled, snip, snip, snip. I think it was like 5-6 cuts. Thing comes out, it was about the size of a grape. And I turned around to him, I looked at him, I said, dude, I'm not staying to close. I'm not your resident. And I left. That was the first big case I did. The first case I did on my own, this is the biggest irony, was an Omeyer reservoir. I had to do it for someone with CNS lymphoma. Do you know that in my residency, I never did an Omeyer reservoir, ever? But
I don't
you
even
put them
know.
in.
I don't even know what that is, so it's all right.
It's a reservoir that goes on the head
Okay.
that the oncologist can put chemotherapy in, so
Oh,
it
okay.
goes into
All
the
right.
ventricular system. So it's really a retard kind of operation. Anybody can do it. But I actually thought to myself when I was doing this case, it was like July 2nd when I started. I started July 1st. So the oncologist consulted me, can you do this for me? And I'm going, I don't think I've ever put an Omeyer reservoir in it. I said, well, it's got to be just like a shunt. So I did it, and I said, tell me where you want the reservoir. And he told me. So I put the burr hole there and connected the whole thing up. And I thought to myself, and this is the funny thing, it's now 30 years after that day. To this day, I've never, ever done a case that I haven't done already at Charity Hospital.
Hmm.
Only the Omeyer reservoir is the only one
You hadn't done.
that fit that rule. But I think I've told people this. I found dental school was more challenging than
Hmm.
anything I did in medical school. And I think what I learned in dental school through the use of a low speed and a high speed drill is absolutely germane to my job in neurosurgery. I can tell you with a drill, I'm a wizard. Like if I was still doing brainstem surgery, aneurysm surgery, I'm when I tell you I was way ahead of the game.
Right.
Like all of the skull-based guys use drills to do this stuff, but back when I started, nobody was doing this.
Right.
It was kind of cool because you could save so much time because really removing the skull, to get to say a basilar tip aneurysm or have to do orbitozygomatic osteotomy. Like for a neurosurgeon, I remember like 25 years ago, that was like a fucking major big thing. And I'd look at him like, dude, this is ridiculous. I mean, Lefort 3 is way harder than this,
Right. Right.
And when they actually realized I wasn't lying to them,
Mhm.
that's when they said, this is going to open up because that's what they wanted me to do. They wanted me to be a skull-based surgeon
Mhm.
and, use all my skill set from oral surgery to do that. Um, the problem is I found out that I didn't really like skull-based surgery because it kept me in the operating room too long.
Mhm.
And even then, when I wasn't wise enough, I knew that taking a long time to do surgeries was not good for me.
Right.
That's why I didn't do it.
Yeah. Makes sense. I mean, I'm actually feeling that now. I mean, I'm feeling my environment is actually is a detriment, just being in my office. So I'm trying to figure out how to solve for those issues.
But I think that's actually the big thing. I've actually a lot of my farm clients are doctors. Uh, that's probably the number one reason that they come to me. They want to know, like, ergonomically, how would I change what
Mhm.
they do?
Right.
And a lot of times it takes a lot because you have to ask questions about like, tell me about your job and what you really have to do, so that
Right.
I can tell you how I would fix it. But I will tell you that was probably one of that was one of the hardest things that I had to fix in myself. But that ultimately is what brought me to Bitcoin, believe it or not.
Mm,
I realized that if I started doing things right for patients, it was bad for my pocketbook.
hmm
So then I started to think, okay, how can I take a reduction in pay and make it stand up? And that's when, I was fortunate at that time to be around people who were in the decentralized world, like the Jack Dorseys and stuff,
Right.
and OG Bitcoiners.
Right.
And I'd love to tell you that I was the class of, 2009, 2010, or
Right.
2011. I wasn't. I was the class of 2013. Why? Because much like everything else, Jack doesn't believe anything that anybody tells him. He's got to look at it himself. But
Right.
I have to honestly tell you, I'm embarrassed to tell you that I had the answer at the beginning.
Right.
Uh,
I
and
I heard about it too, and I
yeah,
didn't.
I didn't do it right away. But it turned out if it wasn't for that decision in 2013, I don't think that I could have changed what I did in neurosurgery, because literally my practice changed on a dime dramatically in 2005.
Hmm.
Like my life from 2005 to 2013 was, I left millions of dollars on the table every year. I,
Mhm.
I would say on average, through that time frame, I lost probably $2 million a year.
Hmm.
Easy.
Just because you understood you didn't need to treat them.
Well, that was my moral hazard. My
Yeah.
moral hazard was, can I go in and do this surgery when I know what I'm doing? Yeah, I mean, if you remember the Huberman
Yep.
podcast, when I said to him, I said, "Do you realize every time I open up a head and put a microscope in there with a xenon light, I know what the fuck I'm doing.
Right.
I know that I'm helping the surgery, but I'm destroying all the melanopsin that's there." So
Right.
I started doing things differently when I did brain surgery. I started doing it under red light. I started using a lot of hydrogen peroxide. I started doing things that nobody else does.
Right.
Uh, and I even had UV light and infrared light in my operating rooms. And you don't think that made me a pariah
Right.
in the operating room suite? You're wrong. It
Right.
did.
Sure.
Same thing. I did surgery. Like say, if I did a decompressive laminectomy before fusion, I would irradiate the dura with UV and infrared light before I closed.
Right.
Everybody, all the anesthesiologists became interested because they're like, everybody else gives Duramorph. They put a needle into the
Right.
canal, into the dura, and then inject morphine. He goes, you never do that, and your patients never have any problems because the anesthesiologist never got called. I said,
Right.
the thing that you guys make fun of me? I
Right.
said, that's the reason why. I said, I'm stimulating beta endorphin.
Right.
And
I mean,
the guy looked at me. He's like, he goes, how the fuck did you figure this out?
Mhm.
And I said, the bottom line is a lot of times I don't even have to put it on the dura. All I have to do is put it on the fascia that I cut going into the back, and it would eliminate a lot of back pain.
Right.
I said, the most important anesthetic that I used when I did back surgery was actually mepivacaine. Why? Because it allowed me to use light more. All those patients, I used light and cold when I did their surgeries, and that's the reason my outcomes are good. And I tell people, I don't tell people this to brag, but I've been a neurosurgeon for over 30 years. I haven't been sued once, not once. And I'm
Right.
in a specialty to get sued more than anybody else.
Right. For
But it's
sure.
because I think I changed the way I did surgery in 2005. I changed everything on a dime when I had that come to Jesus moment, at the foot of Michelangelo's statue.
Right.
I'm like, I can't do this anymore. Like, that's the difference between me and Gooby.
Right.
It's truly the difference. Like, and I have to tell you, my embracing the suck, my pissed offness is the reason why there's no way I'm quitting. I have
Right.
too many motherfuckers I have to prove wrong.
Right. I I actually like that. I mean, the thing that just well, yeah. I mean, I feel like we're like speaking the same language here because like one thing that I actually asked you this question on the forum because like so say I get a CBCT, like dentists use CBCTs now to measure airways and whatever, and it's a lot less radiation than a CT scan at the radiology place and whatever. And it's actually becoming standard of care in lots of places. I don't know if that's good or bad, but that's what centralized dentistry is right now. And almost every single radiology report I get, I see a calcified pineal gland, and like every single report comes back and says this is just a normal finding, and like my brain doesn't allow me to actually accept that that's just a normal finding, because if the pineal gland is
But it is.
calcified,
Listen to what they're saying to you. It is a normal finding because everybody now lives in an alien world.
right, exactly,
That's the perspective change you have to go through.
right,
Remember, they're not having sleep apnea if they live in the world that I'm sitting in right now,
right.
but nobody does.
Nobody
See,
knows, right?
there is
That,
that's the mind fuck.
yeah, that
That's
is
when you begin to realize, okay, I got it. You do
right,
not have to tell me again.
right. So every single all the pineal glands are calcified from our environment, basically. That's really the take home, right?
I also think you can get a normal calcified pineal if you live into your eighth decade of heteroplasmy. I think there's a normal path to getting it, but do I think it's normal in anybody below 80, 85 years old? The answer is probably not.
Mm-hmm.
Um, and I think the earliest pineal calcification I've seen is in a kid with retinoblastoma who was only 5 or 6 years old. But
Wow.
that's a transgenerational one
Right.
that they came into the world with high heteroplasmy, in the retina and also in the hypothalamus. That's why I think it happened.
So that's
But
actually related.
the other thing that's going on too is also the size of the sella turcica where the pituitary sits. Also, there's more abnormalities now than there's ever been ever for the same reason. Like there's other correlates to this. Like people don't realize that size and shape changes occur in mitochondria. The same size and shape changes happen in the pituitary. The reason I'm bringing this up to you may begin to let you realize that how you're looking at the midface and the mandible may be different. Thing about a shrunken midface,
Right.
what does that tell you? It tells you that during morphogenesis,
Right.
there was a change in the energy during neurogenesis and migration. See, I actually believe that all of the changes in the face and the head are all transgenerational epigenetics.
Mm.
They're tied through the maternal line. I
Mm-hmm.
do think daddy has a role, uh, but I don't believe going in and operating all those people is always the right thing to do. In fact, the interesting thing that I have found through my 30 years of thinking about this is if you take someone with a class 2 or class 3 and you put them in an optimized environment, they self-correct.
Mm.
Now, that doesn't make orthodontists happy, but
No.
they'll still have a class 3 and class 2, but you'll notice that it doesn't lead to the collateral effects that those people normally get.
Right. I definitely think if they are vain, then at least in the right environment will at least prevent relapse and things like that. If putting the right teeth in the right place. I mean,
Yeah.
I think there's
I mean,
value there.
I think the big one that I have tried to get a couple of orthodontists to go back and look at the people they created gummy smiles in.
Mhm.
And they refuse to go back and do it. And my opinion is I don't see a ton of people with gummy smiles, with neurosurgery. But the interesting thing is, I talked to my gastroenterology friends. They have a lot of people that have orthodontic work wind up with gut dysbiosis.
Mhm.
And my belief is that change in oxygen tensions has a lot to do with what's going on at the gut.
Yeah, I think definitely there's pieces to that puzzle for sure. I mean, lip seal, vertical dimension,
That's
like
also the reason why people are finding out that mouth breathing and nasal breathing are different. It's all nitric oxide. I mean, I've laid my ideas out on that on the forum. They've been sitting on the forum for a while now. In fact, I have a new member who put something in Ask Jack. The answer's been sitting there. I even
right,
had a doctor read it and say, "This is the most profound, post on this forum." She goes, "Why am I just seeing this now?" I said, "Well, probably because you're low agency."
right. Yeah.
Look, people don't realize you go on my forum, there
Hmm.
is so much information on that forum. You just physically have to do the proof of work.
Right,
You don't do the proof of work and learn the things that I'm laying down. That's what frustrates me. When people on Twitter ask me a question, I'm like,
right.
bro, go read a
Go
fucking
read.
blog.
I have them printed out all over my house, by the way. So I'm a little bit of a slow learner, but I mean, I'm definitely getting there. And we've been 2 hours, and I don't want to keep you any longer. I know it's Chantel's birthday, but
Yeah. I gotta get moving. She's over there screaming at me now. I gotta go. They
All
are
right.
screaming at me.
Thanks, Jack.
All right, take care.
Okay. Hey there. Thanks for listening or watching. Lots to mull over there. He makes a fairly compelling case for what the quantum biology is. I believe most of it it makes sense to me. But like I said, we need data. We need a lot more data. I'm hopeful we can get that data at some point. But what I do know that seeing the morning sunrise, getting in the sun during the day, being outside more than inside, watching the sunset, and then blocking the blue light at night, it has been beneficial for me to help my sleep. I'm not an apnea patient, but I struggle with poor sleep. It has helped me. It has helped a few of my friends that have actually on it too. Worth something to give a shot. Give it a try. Thanks for watching, and obviously if you liked it, give a thumbs up, and then leave some comments or thoughts. And I'll see you next time.